Alrighty, so you back? You with me?
Yes, sir.
Alrighty. Now, let's see here. Dental and vision of importance or no?
Yes.
Okay. All right, now what I'm going to go ahead and do is let me get a zip code for you, and I'll place you on hold. I'll take a look at what's available, and I'll be back on the line shortly with the best option.
91913.
Perfect. Bear with me 1 second. I'll place you on hold. I'll be back on the line shortly with the best option.
All right.
Alrighty, sir. So I found a policy with dental and vision's a little high up in pricing, but I did find one with your health coverages as well as your prescription coverage. It's a policy through a company called Multiplan. A Multiplan is the largest PPO network in the entire country. Over 80% of doctors and hospitals utilize that as a coverage. All right, unlimited doctor's visits, diagnostic testing, medical, surgical, and hospital coverage with no deductible. And it has prescription coverage that would cover your prescriptions upwards to 80% with no deductible. Okay? The policy is $237.88. For the first month, there's a one-time $135 medical underwriting fee. That just guarantees that, one, the policy is good nationwide. Two, it's going to lock in the rate. So as long as you maintain the premium, it's a guarantee that the policy never increases. And last but not least, you cannot be dropped for any reason until you turn 65 and become eligible for Medicare.
Okay.
All right. $237.88. Does that sound like an affordable price range for you before we continue?
That's okay.
That's a good price range? You're good with that?
Yeah, we can go with that.
Okay, perfect. When exactly is it that you were looking to start the policy?
Within the next week.
Okay. What we would need to do is finish up your application and submit it to the carrier. Okay, they would have to do a verbal confirmation with you for your protection. All right. Now, we could make it effective as early as midnight tonight if need be. A second here. Let me get on the line with the carrier. I'll be back on shortly. Bear with me. Yes, we can make your policy effective as early as midnight tonight.
All right.
All right. Let's see here. Let me go ahead and what I'm going to do is I'm going to go ahead and start the process. We would have to finish up your application, submit it to the carrier. Is there a middle initial that you want on your card?
B.
B? Let me go ahead and get the full. Hold on. Give me 1 second. Now, that 237 is without the dental and vision. With dental and vision, it would have went up to 291. That's why I didn't even bring it up. Okay? But just in case you ever decide to get it, it could be added on later on.
All right.
Mm-hmm. Second here. All right, so we got this, and then we got this here. Perfect. All right. Now we're going to make it effective midnight tonight, which is perfect. Let's see. All right. Your first name, sir?
Kevin.
Kevin, middle initial?
B.
Last name?
Campbell.
Campbell?
Yeah.
Date of birth?
1998, June 21st.
98, you said, right?
88.
88. All right. Now I got your phone number down as 619-576-1224. Let me go ahead and get an emergency contact for you.
That is on the phone number.
I would need another one on file, just in case anything does happen to you, they have someone to contact. So say, for example, if you have nobody to contact immediately, say, for example, something happens, like an accident or something like that, they could contact someone else for you. They could be anybody. It's not like we're going to call them. We just wanted to make sure that we got them on file.
All right, let's do 425 528 1070.
Let me go ahead and get your email address. This is where they're going to be sending out your temporary IDs and login information.
Kevin B. Campbell at dayrep.com.
At what now?
Dayrep.com. DAYREP.com.
Kevin B. Campbell. EAYREP.com. Perfect. Physical address?
Let's see. 1564 Summerland Street, Chula Vista, California, 91913.
All right. I got on the address was 1564.
1564 Summerland Street, Chula Vista.
Summerland. Is that one word or two?
One word.
Gotcha. City?
Chula Vista.
Chula Vista. All right. 91913. Now, to solidify the policy, would you like to use a Visa, MasterCard, American Express, or Discover?
Let's see.
Now, this would be the card where the recurring billing would be done on.
Let's do MasterCard.
Okay. And it is the same billing address and the same name on the card as it displays?
Yes, sir.
All right. Whenever you're ready with the card number, sir.
5579 17112. I'm sorry, 1712
Mm-hmm.
5167 5962
Expiration?
4/20/2023.
Okay. And last but not least would be the CVV.
380.
Now, do you want to include the dental and vision? Because there's no extra. It would only be the price of the actual dental and vision, which would be an additional $53.97.
Okay, let's see.
So it'll be $291.85 a month.
Okay. Alrighty, let's see. Alrighty. Now, what business would it be through?
It would be through a Dentamax PPO, and that would cover you on orthodontics, cleanings, fillings, caps, crowns, root canals, braces, bleach whitening, dentures, bridge work, even implants.
Okay.
It also comes with vision as well.
And
Through eye benefits, and that would cover you on eye exams, frames, contacts, lenses, things like that.
all right. Are you calling from Dentamax?
No.
Who are you calling from?
Well, we're the Health Market Care Center. We're an independent brokerage. Remember, they transferred you over to me. Right. It's up to you. I mean, if you wanted dental, you can, but if not, it's okay too.
So, are you like the contractor? Or are you?
Correct. I'm more of like the middleman. So what happens is this: once you get the say, for example, this is the policy we're going with, right? You would have to do a verbal confirmation directly with the carrier. Okay. It's based off California state law. Once that process is done, they send out an email. It would have your temporary IDs. It would have your login information for your policy. Within 7 to 10 business days, you get your cards in the mail.
Okay, but you
That's
don't,
simple.
you're not working for the company, are you?
Like directly, no, we're appointed. So it means that I'm not like a direct employee. Say like I get up every morning and my shirt says, you know, multi-plan on it, but we're affiliated to the point where we sell the product. Yes.
Okay.
Well, we sell various products.
So what company are you a part of?
The Health Market Care Center. It's an independent brokerage again.
Okay.
Okay. Now, what I'm going to do is I am going to place you on hold. Let me get this over to the verification and compliance department. You are talking to me on a smartphone by chance, right?
Yes, sir.
Okay. Part of the process is to receive a text message, but I'll walk you through that part once we get there. Did you want to go with the dental or vision, or you want to exclude that today?
We can go ahead and skip that for now.
Okay, not a problem. Bear with me 1 second. I'll place you on hold. I'll be back on the line shortly. All righty. Now, on behalf of MultiPlan and the Health Market Care Center, I want to be the very first to congratulate you on your new policy. The first thing I want to do is I want to give you the customer service number. If you have any questions between now, the time that you receive your paperwork, or even afterwards, okay, please don't hesitate to call.
Okay.
That number is going to be 844
844
263
263
8685.
8685.
Now, during a group enrollment period, members are approved today, regardless of pre-existing conditions, with no deductible. And on verification, I'm going to let you know that this plan is under a group enrollment period. Now, what we do is we transfer you over to a second-party licensed agent to do a verbal confirmation with you for your protection, to ensure that we've done our job correctly. They read a very generic script word for word. I want you to know what parts are going to affect you and what parts aren't, because they literally read the exact same script for everyone. First thing they're going to read to you is that there is a 6-month pre-existing condition clause. Now, what that means is anything newly diagnosed within the last 6 months has a 12-month wait period for surgical and anesthesia benefits related to that condition only. But you haven't been diagnosed with anything within the last 6 months that needs surgery, right?
No, sir.
So it's not going to affect you, okay? Now, the very next thing I want you to do is I want to go over your billing, all right? So similar to getting it through an employer. If you have multiple layers of enhanced coverage, such as your health coverage and also your prescription, you're going to itemize it, similar to when you get it through your employer, how they break it down and they just bill you individually. That's exactly the same way it's going to be done here. The first thing I want you to write down is going to be health.
Okay.
The next thing is going to be RX, or prescription.
Okay.
Now, the way we're going to break this down is as follows. The first line is going to be the premium. To the right of that, your one-time medical underwriting fee, because that's also split up. And then to the right of that's going to be your total, okay? For the health portion, $189.95. To the right of that, $99.95. Okay, that's for the medical underwriting fee portion. So your total there is going to be $289.90.
Okay.
Okay, your prescription coverage is going to be $47.93. To the right of that, $35 for the medical underwriting fee. That's going to give you a total of $82.93. All right, if you add up both totals, it's going to give you your first month's premium of $372.83, which is the $289 and the $82.93 added up. Okay. If you subtract the $99.95 and the $35, that brings you back down to your recurring monthly of $237.88. All right. Now you'll be billed today, made effective for midnight tonight. Your next payment won't be until the 14th of March, and that would be for the 237.88. Okay. They're going to state in verification that this is not a major medical plan. It's a group accident, sickness, and hospital insurance plan. Now, don't be confused by this because a lot of people tend to think major medical stands for any major hospital occurrence because of the word major. All right, but it doesn't. It has nothing to do with what the plan covers. It has to do with the structure of the plan. In order for a policy to be a major medical, it would have to have a couple things that your policy does not, which is pregnancy coverage, drug and alcohol abuse coverage, deductibles, and co-insurances. You literally have none of those. So because of that, it's labeled a group accident, sickness, and hospital insurance plan. Okay? You're going to receive a email, and it's going to go to Kevin B. Campbell at eayrep.com. The most important email will state register your new healthcare plan. That'll be the one with your temporary IDs and login information for your policy. Now, within 7 to 10 business days, you should be receiving your cards in the mail. Okay. Once you receive your cards in the mail, go ahead and put those in your wallet for safekeeping. Okay, just to make sure that you got the that you don't lose them or misplace them, because those get misplaced often. Let me go ahead and give you the confirmation number for today.
Now on that email, did you say DAY or EAY?
EAY.
It's gonna be DAY. D as in day.
Oh, DAY. Okay, so it's DAY. DAYREP.com.
Dayrep.com.
Got it. No worries. I'll go ahead and have them change that now. Let me go ahead and give you your confirmation number for today.
All right.
M as in Mike. C as in Charlie.
C.
1883.
1883.
Yes, sir. Now you will give me 1 second. I'm going to place you in a brief hold. Okay. Bear with me 1 second. Alrighty, so you're the very next one in the queue, okay? Bear with me 1 second. I'm going to place you on hold, and then we'll get you transferred over, okay?
All right.
Bear with me 1 second. I'm going to go ahead and transfer you over now, sir.
Okay.
Hello, Kevin.
Hello.
Hi, Kevin. My name's Lauren. I'm in verification. Your confirmation number is MC1883.
All right.
All right, sir. Before we get started, I'm just going to go over a few things with you. I see this is an individual plan for yourself. It goes into effect midnight tonight, February 14th, Valentine's Day. And your first month's total is $372.83. You have a one-time enrollment today of $134.95, and then every month thereafter it'll be $237.88. Correct, sir?
All right.
All right. Can you receive text messages
Yes, ma'am.
on this line?
Yes, ma'am.
I'm sending you a text message. It's from a 314 area code. Just let me know when you receive it. I'm going to walk you through it.
All right, I received the text message.
All right, that was fast. So when you open that up, you're going to see a link, and the link says signmyplan.com. Go ahead and click on that link. Just let me know when it opens.
It's opened a web page.
All right, good. So what we're going to do, just verify that all your personal information is correct, like your name, your address, your date of birth.
Dayrep, DAYREP.com.
I'm sorry?
The email there says EAYREP.com. It should be DAYREP.com.
Oh, all right, let me fix that. All right, so I went ahead and fixed that. You'll see it updated on the next form, okay, sir?
Okay.
All right. So on this, does everything else look correct?
Yes, ma'am.
Very good. You're going to see a space at the bottom of the page where you could type your first and last name. Just let me know when you're there. You see it, sir?
Yes, ma'am.
All right, on this, it's just your first and last name, no middle initial.
All right.
And hit that I accept button. Let me know when you have a thank you message.
It says thank you.
All right, sir. And now I'm going to go ahead and send you a second text message. It's coming from an 855 area code. It's just as easy as the last. It's just a little different, okay? And you'll see that updated email on this form. Did you receive it, sir?
Yes, ma'am.
Oh, okay. Let me know. All right. So go ahead. You see the link. Did you already click on that?
Yes.
All right. And you see your updated email on this?
Yes.
All right. On this page, just let me know when you get towards the bottom. There's going to be two boxes. One of them is going to say electronic signature. You're there?
Yes, ma'am.
All right. So just use your finger on the screen in the electronic signature box to sign your name, kind of like you're drawing. And it's going to look cool and messy. Don't worry about it. They just want to make sure you're not a computer.
Okay.
And then you type in the box below, no middle initial again.
Okay, and you said accept?
Yes, please.
Alrighty, it says complete.
All right. Now I just need you to grab a pen.
Okay.
I'm going to go ahead and give you the billing number.
All right.
Okay, we're doing a very brief voice recording. You actually have to repeat this number back to me, so just keep it handy. It's 855
855
212
212
2303.
2303.
You got it, sir. And also, you're going to have to repeat back the last four digits of the credit card number that we have on file. What I have is 5962.
5962?
Yes. Correct?
Correct.
All right, so just keep those on you for this verification. I'm just going to prepare you because the carrier is very strict. They want a very clear yes or no to the questions. It should be a yes across the board. I'm going to go ahead and knock out questions that usually come up so we don't have to stop, sir. People ask, like, what are the limited benefits of my plan? When they hear that word limited benefits of this plan are going to be pregnancy and substance abuse, childbirth, and then have you recently been diagnosed with anything in the last 6 months?
No, ma'am.
All right, if you were, you're going to hear the 612 pre-existing clause, and it's just stating that if you were recently diagnosed in the last 6 months with anything, you'd have limited benefits on certain types of coverage. And what they're referring to is like surgical and anesthesia, okay? Then you're going to hear because these limitations are not associated with the Affordable Care Act. And then after that, you're going to hear because of this, you may be subject to a tax penalty. That was actually reformed January 1st. It no longer exists except for like 2 different states, which is not California. So it's not a worry for you. Do you have any questions before we begin?
No, ma'am.
All right, so let me just go ahead and get started. That's a very clear yes. I'll get you to this very fast. Today is February 13th, 2019, and my name is Lauren. This call is being recorded for quality assurance purposes. The agent that you spoke with today is Ramon Paez. Please confirm your name, your address, and your date of birth.
Kevin Campbell. The address.
And your address?
Sorry.
That's okay. Sir? Kevin?
Can you hear me?
Now I can. I went ahead and stopped the recording. Do you have your address on you?
Yes, ma'am. Sorry, my phone was acting up.
No, that's okay. I'm going to go ahead and restart the recording. I apologize. I just want to make sure you're still with me. Today is February 13th, 2019, and my name is Lauren. This call is being recorded for quality assurance purposes. The agent that you spoke with today is Ramon Paez. Please confirm your name, your address, and your date of birth.
Kevin Campbell. The address is 1564 Summerland Street, Chula Vista, California, 91913. And the birthday is 1988, June 21st.
Thank you. Do you understand that you've selected a membership package that includes an accident and sickness hospital indemnity insurance policy, along with other complimentary benefits and services associated with your association membership?
Okay.
Is that a yes?
Yes.
Thank you, sir. Clear yes or no. Do you understand that if you have a pre-existing condition, the limited medical benefits may not be immediately available for claims associated with this condition?
Yes.
Specifically, do you understand that if you've had care rendered or prescribed you by a physician within the 6 months leading up to your effective date, you have a waiting period for 12 months before any claims related to your condition will be covered?
Yes.
Do you understand that benefits included in the UCA membership are not major medical or comprehensive medical insurance coverage and are neither minimum essential health benefit plans under Affordable Care Act or policies of workers' compensation insurance under state law?
Yes.
The plan shall pay the benefits amount listed in the schedule of benefits to be included in the membership material sent to you upon enrollment. You do understand that if you do not have minimum essential coverage, an additional payment of your taxes may be required under federal law.
Yes.
If your medical costs exceed the benefit limits and you're responsible for any charges above those limits as defined in this plan, to minimize your share of the cost, we'll guide you to the most convenient participating provider in your area. Do you understand and agree?
Yes, and I agree.
Please review the schedule of benefits in your fulfillment materials once you receive them. And if you have any questions or are confused about any benefits, please contact us so we could help you. Do you understand and agree?
Yes, I agree.
Do you understand that if there's any discrepancies between what the agent told you about the plan and what the actual policy states, that the policy terms will apply?
Yes.
Thank you. Now, you will see a total of 2 charges on your billing statement each month. One charge is for your health coverage and one charge is for your Platinum RX. These charges add up to a total of $237.88, which will be drafted monthly. Do you understand and agree?
Yes, and I agree.
Also, there's a one-time enrollment fee for today's purchase totaling $134.95. Please write down how all these charges will appear separately on your billing statement. Your health coverage today is $289.90. One-time enrollment of $99.95 and will be $189.95 every month thereafter. And your Platinum RX is $82.93. One-time enrollment of $35 and will be $47.93 every month thereafter. All these charges will be billed separately and billed every month on a recurring basis on the 14th, unless you call us to discontinue your membership at 855-212-2303. Do you understand and agree?
Yes, and I agree.
Please repeat the number back to me to make sure you have it.
Is that going to be the customer service phone number?
The billing number?
No, okay, that's 855
Mm-hmm.
212 2303.
Thank you. Please write the word billing next to that number as you call with any concerns regarding your monthly charges. Please repeat the last 4 digits of the credit card number you wish to be billed from each month.
5962.
Please note that your membership rates will never increase as long as you remain an actively paying member to authorize your monthly dues to be billed on an ongoing basis.
Alrighty, yes.
Do you have the billing number written down so you get a hold of us and any questions regarding your billing?
Yes.
Great. Please file that number in a safe place. Also on your bank statement, the billing descriptor will read benefits 855-212-2303. You will be receiving a confirmation email from us titled Health Registration Department within the next few hours. Please check your spam folder to access your benefits. Within the email, you could search for providers, activate, and access your new benefits. Thank you very much for your time and welcome aboard as our newest member. All right, sir. So what I'm going to do now, I'm going to go ahead and process your information very quickly. It'll be one moment, okay?
Okay.
Thank you. All right, sir, here's what I need to do because the charge was actually declined. Do you have your card on you?
Yes, ma'am.
Okay. What I have is 5579-1712-5167-5962.
Alrighty.
Can you read it back to me?
5579 1712-5167-5962.
That's it. Expiration date
4/2023.
and your CVV code.
380.
All right, that's exactly what we have. And your billing address is the same as your mailing address?
Yes, ma'am.
Do you have another card available?
What company will be charging the card? I might have to verify it.
What company? It's good to say Continental Care.
Sorry, Continental Care?
Yes, sir.
Okay. Okay, let's try another one. All right.
And then the portion that I charged that declined was only the for the health portion, which was $289.90 was what just declined.
Okay, let me see. All right. So I looked up the company name. I looked up. You guys have a 1-star review. What's going on here?
All right, sir. So whatever reviews you're looking up, you could do the same thing with Blue Cross and Blue Shield. You're going to see the same thing with any company.
Okay. There's just a lot of reviews saying that do not insure with these people.
I had this insurance myself 3 years ago before I started having children, so it's not the insurance for me anymore. I was covered to go to the doctors. Everything was fine.
Were you covered for the pregnancy?
No, they do not cover for pregnancy. That's why I'm no longer with this insurance.
Okay. It's just very misleading when you go on here and look at all these 1-star reviews.
The only thing that this policy doesn't cover is substance abuse and pregnancy. It also does not cover in psychiatric mental health. But I mean, you can see a psychiatrist. So if you're not looking for coverage for these things, you'd be absolutely fine, sir. And you got to understand there's a lot of different agencies that sell this insurance. So I don't know if you're looking exactly on us. You could also look up multi-plan. And if you do have any doubts, you do have a 30-day cancellation period with your money back.
And is that full money back, or is that?
You would be missing your enrollment fee.
Sometimes
I see that $134, which is a one-time enrollment fee.
Right.
But because these limitations that you have on your insurance, that's why you're not paying like $800 a month. And also, you don't have any major pre-existings, like say cancer or something like that, which unfortunately this group would not be good for. Of course, if it happened while you're insured, everything would be fine. But pre-existing like that, you'd have like a 12-month waiting period, like I said, for like a surgical or anesthesia benefit.
Okay, let's go ahead and try this card.
Okay.
The name on it's going to be Michael Huff.
Okay.
And it's going to be a MasterCard. It's going to be 5451
5451
9499
9499
2984
2984
1287.
1287. Expiration code, sir?
5/2023.
0523. And your CVV code?
045.
045. Billing address for this card is the same or no?
So that one's gonna be 1990
1990.
Wood Duck Drive.
What is it? I'm sorry.
Wood Duck Drive.
Oh, like a duck. One word or two?
2 words.
Wood Duck Drive. City, please.
Marquette.
Spell that for me.
MARQUETTE.
Okay. Zip code?
Let's see. 49855.
49855. And of course,
Yeah.
it's in California, correct?
It's gonna be Minnesota. Michigan, I'm sorry.
Michigan. Okay. Let me just update this information. It'll take me about 1 minute. I'm not going to put you on hold. You can stay on the phone with me.
And which company are you calling from?
Me, I'm in the verification department for Health Market Care Center.
Okay.
Yeah, I don't work in sales at all, sir. Not my forte.
You said Health Market Care Center?
Health Market Care Center.
Is there a website for that?
Yes, and actually, you could even go, like I was saying, on the multi-plan website. And just to make you feel a little more comfortable, go ahead and just take a look at everything. Because I know sometimes doing these things over the phone, you may be a little apprehensive. So I know looking at information right in front of you is fine. And then after I'm done processing this, you're going to receive the email with all your information in it. I'm going to give you your member ID number.
Okay. Is there any way you can process that email right now?
Yeah, it's going to happen right now. As soon as this goes through, you're going to get it automatically. It says within 24 hours, but it's always immediate after processing. And to review that number with you, sir, what I have is 5451-9499-2984-1287.
Yes.
Okay. And expiration was 523.
52023.
And you said the zip code was 49855.
49855. Correct. And your name was?
My name is Lauren.
Okay.
This one also declined, sir. I tried running it twice.
Okay. All right. Let's see. Alrighty, Lauren. Let's see. Give me a moment.
All right, sir. Take your time.
Lauren, are you there?
Yes, of course.
Okay, so okay, you're okay. All right, okay. Alrighty. Okay. Let's see. What is Okay, all right. Hello, Lauren?
Yes, sir.
Okay. Lauren, I just wasted 45 minutes of y'all's time. Don't call back. You got a good laugh out of that.
Serious?
Yeah, I did.
Serious?
45 minutes.
Sir. Well, why would you make me suffer through that, sir?
Because everyone's suffering. You guys are calling every day for like 3 months straight. I've been doing this for the past 5 days.
I know, sir, but what does that have to do with me? I don't call you.
Because
why would you
guys,
put me through that today?
whoever's company is doing this needs to stop. Like, I've gone and I've talked to an attorney about it.
All right, sir.
Last company was was it? Hold on, let me see. Assurance Insurance Company. I talked to their attorney about it this other day, Monday. What's going on?
All right, sir. I just want to go ahead and thank you for the laugh today.
Do you have a manager?
Okay. Sir, I'm in verification.
Okay, well, is there a manager I can speak to on the floor? Lauren? Are you still there, or is your voice over IP not working? Or did you hang up and your voice IP didn't hang up? I'll wait just in case you're on mute.
Sir.
Hello? Hello? Hello?
All right, sir. I'm still with you.
Okay.
So, would you like to speak to the agent or?
Whoever's the manager on the floor, someone else.
Sir, I'm in verification. You don't have management here. We just verify the policies. I have nothing to do with sales.
Okay. Well,
Okay.
Who the hell? Who can I get transferred to get like contact with like a manager, and then the manager can give me the legal team, unless you can give me the legal team.